All right, so in this video, we're talking about the respiratory system, the anatomy and physiology of this system. First, we're really going over the anatomy of what it involves. So you're pretty much, you breathe in, right? You inhale. The diaphragm muscle in your stomach drops down, and it allows air to fill up in your air bags, which are your lungs. The air then gets filtered, and you bring in oxygen into your bloodstream that is used to pump into your cells, right, to help them do their function, create energy and do their function, pump to your brain and every organ and cell in your body. And then you exhale, and carbon dioxide and smoke and things that your body doesn't need, that's airborne, it can be excreted that way. But the pathway, we have to look at the pathway and how it all works, I guess. Step 1 through step 7. So first thing is, we should be breathing through our nasal cavity, right? So we should be breathing in through the nose, because the nose is designed to actually spin the air and warm the air up. So when it goes down to our lungs, it is not too cold, right? And it's easier for us to breathe and for the organ to function. We also have hairs in our nose, and we have a lining that has mucus to catch any sort of debris, right? Debris, viruses, things that the body doesn't need, to be able to either swallow it and it goes into the stomach acid, or it's coughed back out or sneezed out to keep us from being sick. If you're a mouth breather, then you are breathing all that debris straight into the lungs, right? So there's mucus in the, within the tract, but it's, I guess, kind of bypassing the front guards at the gate, right, and going in the side entrance. So there's a higher chance of somebody getting sick, right? So ideally, we want to breathe in through our nose. We get 20% more oxygen by breathing in our nose. Okay. So nasal cavity is a space inside the nose, like I said, and we have kind of like a turbine here. And then we have these sinuses in here that actually helps to resonate sound. So if your nose is ever clogged up when you're sick and you sound like you're underwater, these sinuses can get filled with mucus and get irritated. So we can actually sound like we're underwater versus having this resonance. Then we have our throat. So the air comes in, goes in the back of the throat, which is also called the pharynx. So again, this debris usually gets trapped in the hairs and mucus in our nose and the nasopharynx here. And then if anything is left over and not trapped, then there's mucus that it can get caught in the back of the throat, right? And then you cough it up, or it triggers your body to sneeze and you sneeze it out. Then we have these eustachian tubes. These actually will drain mucus from the ear canal into the back of the throat here, right? So it drains all of that fluid out. So infants can get tubes in their ear to actually help this passage drain, so this bacteria doesn't build up in the inner ear canal, which is not good. So air comes in here, goes through the pharynx, and then we go down to the larynx, which is our voice box. So as we're breathing, this voice box resonates and produces sound, so we can speak and we can sing. And then it helps protect the trachea from food getting clogged down there, right? So like the glottis, the vocal cords, they fold and they resonate and they open and close. So phonation, breathing, allow air to come through easily, right, by opening the passageway, and then preventing food or liquid from entering the trachea and lungs. So they always said in the military, don't talk and eat, don't walk and eat, because there's kind of like a doorway that opens and closes. Liquid goes into your stomach, and then it flaps over and air goes into your lungs. And sometimes we sometimes say it's going down the wrong pipe. There's only one pipe. It's just the wrong flap is open, and then we get liquid into our lungs and we choke. Okay, so the voice box also changes shape to help our volume and pitch. So when we're singing, the more that the singer can control this area of the throat, then they're going to have a louder, more vibrant, more clear sound, right? And of course, helping us modulate speech, learning how to speak different languages, right? All right, so now going down to the trachea. So the trachea is our windpipe. So this provides a clear and open passage for the air to come through, right? So it has this rings of cartilage here to help protect it and help keep it open, help keep this tube open so that the air can go down and go into the lungs, right? So, and like I said before, just like in the nose and throat, we have mucus, right? We have different microbes in there that, or different hairs in there that trap dust and microbes so that our body doesn't get sick, right? It's like our defense system. So we have this cilia that actually kind of traps the mucus, and then little hairs move this fluid back up so it can be swallowed, or you can kind of sneeze it out or hack it up, if you will. So it tries to remove anything from going down into the body too far. And like I said, it's got these C-shaped rings made of cartilage that help support and protect the trachea. And also it's flexible. So if you swallow like a big, let's say, chunk of apple by accident, it hopefully won't get caught in the back of your throat. Your trachea will expand and the food and the apple can go down into your stomach. Okay, so now the air comes in and it goes down into what are called bronchi. So they're like trees. So I think of these trees as if you've ever like been to a vineyard. So like a grapevine, right? So you have the main stalk, and then it branches off, and then it branches into smaller branches, and then at the end you have grapes that grow on the ends. So these bronchi, obviously it goes down in both ways, in both sides, left and right, but right here it's just showing one side. So if I take away this lung here, and also notice that the lung on the right side has 3 lobes, the lung on the left side has 2 lobes, right? And it has a space here. So this space is for your heart to sit. So the right side is a little bit lower, so things can get caught and fluid can build up in the bottom of the lung if somebody gets pneumonia or gets things caught down in there. So just a fact that they're going to ask you on the NBLEX. So if we just cut away the lung here, we're going to see that you have, well, get this way, just to visual hold together. So we have these branches. So it's going to come down and it's going to go into your primary bronchus, and then it's going to go into your secondary bronchus, which is this smaller branch. And then you have your tertiary, which is going to be these smaller, even smaller branches, just like a tree. And then on the end of these branches, this is where the grapes are. And in this case, they're called alveoli. So these grapes are at the end. And these are like the Brita filters of our lungs. So we breathe in air from around. Could have smog in it, could have air fresheners and tobacco smoke and all this stuff in the air. And then these little things filter out all that junk. And then it brings the oxygen into these capillaries and then absorbs the oxygen into the body. And then that oxygen goes to the heart, and then the heart pumps that blood filled with oxygen out into the body to go to every cell and organ of your body. Okay, so these are just think of these as little Brita filters. And when people that get smoke a lot, get emphysema, or like in Zoolander when he gets the black lung, you know, this filtration system gets clogged up. Like if you dipped your Brita filter in like tar or a bunch of mud, it's not going to filter the water out very well, right? It's going to be clogged and backed up, and then these can actually start dying, and then the person's lungs turn black. All right, so you have one grape, looks like kind of like a raspberry, and then this is the individual alveoli inside that actually filters all of the debris. All right, so you have actual macrophages that go in there and eat debris and eat anything up. So like these little individual things are kind of like lymph nodes, where like they filter out the fluid. This just filters out air. Okay. All right. So the main thing that they're going to ask is that the lungs do gas exchange. So we're not just breathing in oxygen, we're breathing in oxygen plus other gases, and then it just filters the oxygen out and absorbs the oxygen into the bloodstream. Okay. And like I said before, we have these sinuses, so paranasal sinuses. Think a pair of sinuses in your nose. You're going to have them in the front of your face. You're going to have them between your eyes, right? You're going to have them where, remember we went over the bones of the skull. So the sphenoid bone, that butterfly shaped bone, is going to be in that area, and then it's going to be above your cheeks and your teeth or your maxilla. So we go back here, you're going to see that we have these sinuses here. So you have your frontal sinuses, right? You have your ethmoid sinuses right below. So it's kind of like near your tear ducts. Then you have your maxillary sinuses, because it's right near your maxilla, your jawbone. right? And then this is the sphenoid bone here. So you have your sphenoid sinuses right in between that bone. You see how this looks like a butterfly or a moth or a bat? I don't know, some flying thing. So that's your sphenoid bone. So all of these are open and have chambers that help resonate sound. And also it's a kind of an airbag. If we smash our face into something, it's going to help protect the kind of the shock absorption. All right. So it makes your skull lighter, a resonance chamber for sound, and like I said, like an airbag. So that's pretty much it for the anatomy. And then just pathology that we're going to see is the common cold. So this is the upper respiratory tract. So to show the difference, this is the upper respiratory tract here in your face, in your throat, and then lower respiratory tract is going down into the bronchi and the lungs. Here, okay. Right. So when you have like a sinus headache or sinusitis or the cold in your face, it's not going down to your lungs where your lungs are really irritated and inflamed. Okay, so that's the upper and lower areas. So you got the common cold, you got, like I said, sinusitis, sinus plus itis, inflammation, pharyngitis, inflammation of the pharynx. This is usually from streptococcus bacteria. You get strep throat. Laryngitis, you scream too much at a concert, or a singer sings very loud for a long time. All that resonance and it can get irritated, but sometimes you can get a virus down there that can actually camp out and cause inflammation. Of course, you can get cancer there if that inflammation goes too long and the body can't heal itself. Influenza or the flu. Mononucleosis, another viral infection that can affect the face, tonsils, throat, lymph nodes, but it can also go down into the lower respiratory area as well. So it usually starts up here because we either breathe it in, it gets in our eyes, gets in our ears, nose, somehow it gets in some orifice, some area, and then it works its way down our body. So lower respiratory tract conditions, we got pneumonia. So like I said, because this right sac is larger than the left because of the space for the heart, fluid can actually fill down into the bottom of that there, and it can kind of drown these alveoli. Tuberculosis. Remember, we get our TB tests. So if you work in a nursing home or with people that are elderly, TB spreads very, very quickly. So you have to get tested quite often. I think like every 3 months. All right, pleurisy. So on the outside of the lungs, there's a lining called a pleura. So this lining actually gets inflamed and irritated. So there's like a kind of saran wrap with like fluid around to allow the lungs to expand and slide up and down inside of the rib cage, right? So it has this kind of like protective, slippery coating on the outside, but that can get inflamed. And then when they breathe, it's really painful because it's pressing up against your ribs, and it's just, it's irritated because you can't stop breathing. So every time the person breathes, it rubs and rubs, and it causes more inflammation. And then of course, if we have so much going on in the lungs, especially if we're smoking and clogging up our system, and our lungs can't get enough debris out, and it's getting toxins, then the lungs can just start, those cells can get cancerous, and then they spread, and then your body wants to try and survive, but those areas of the body are dying. You can also have COPD, so chronic obstructive pulmonary disease, so something that is lasting for a long time that is obstructing the airway or clogging the airway of your lungs. So asthma, when the body produces too much mucus, and then there's irritation. So somebody that has asthma can have an asthma attack from many different things can trigger it, but usually like dander, pet hair, pollen things can actually trigger the body to create more mucus to pull that debris out, but then it clogs the airway, and then it causes just inflammation and constricts the airway, and then the person can't breathe. Bronchitis, again, too much mucus and inflammation in the airway. So if you get like a really bad chest cold and you have bacteria and things in there, or viruses in there, the body is trying to create more mucus to excrete that pathogen, but then it can create too much inflammation and mucus, and then it can narrow the airway, and then it's hard to breathe. Okay, like I said, emphysema from smoking, these alveoli die off because you're dipping your Brita filter into a mud puddle. The black lung here, coal miners breathing in all that coal dust, clogging up the alveoli. So you see how the CO2 and O2 is in there, like the body has to filter the oxygen, but if it can't filter the oxygen, then you're getting less oxygen, and these cells are just dying, because these cells need to innervate themselves with blood vessels to stay alive. So if it can't bring in oxygen, they're going to die off first, and then the rest of the cells are going to suffer. Bronchiectasis, so your lungs, it becomes hard to clear mucus. You get this like thick, gunky stuff in there. And then it just develops like these pouches, and then things get stuck, right? So it's like it's thickening the airway, and again, it's less air can get through, and then you're not getting enough oxygen. Cystic fibrosis, sometimes genetics cause thickening of the mucus in the airways, and it blocks, so when they breathe in, the alveoli cannot take in oxygen, and it cannot bring it to the rest of the body. And then you have sleep apnea, where you have an obstruction. Usually this happens when people are overweight, and the weight of the head and throat actually can shorten the airway. The tongue can fall back in the airway, and the person can snore. But then if they're in a flattened position, then that airway can actually cut off, and then their body wakes up because it can't breathe, right? So in order to realize if you have sleep apnea, sometimes you wake up, but your body doesn't wake up completely, and then a person is sluggish, and they just kind of wake up and eat coffee all the time, and don't realize that they're not getting a good night's sleep, or don't realize why they're not getting a good night's sleep. And then they go to a sleep test, where they go in and they put a machine on you, and they monitor you, and it'll show how often the airway is blocked. And then usually they'll get a CPAP machine, which it's like a mask to help that person breathe throughout the night, so their body's getting enough oxygen so they can sleep well. All right. So that's about it. It's a pretty simple system.